first, let's get rid of this slide. There we go. There's clearly a connection between health and wealth. We've been conducting a survey at EBRI, the Health and Workplace Benefits Survey, for a number of years, and we find this connection where, because of rising healthcare costs, a significant number of people tell us that they've been affected financially. 26% tell us that they've reduced their contributions to a retirement plan. 43% tell us that they've decreased their contributions to other savings. And you could see all the different ways in which people are affected financially because of rising healthcare costs. There are so many different aspects so many different directions that we could go as a panel in terms of this connection between health and wealth. And we're going to focus on HSAs. Maybe it's because it's one of the easiest ones to talk about. There's lots of data, lots of talk about it. And just real quick background, because I find that even after 15 years now of having HSAs around, there's still a lot of questions people have about them, and still a lot of people don't know about them. And this is just the basics. They benefit from a triple tax advantage. Money goes in tax-free, builds up tax-free, and it comes out tax-free for qualified medical expenses. There are limits in terms of how much you could put in. If you have individual coverage, $3,450 this year. If you have family coverage, $6,900 this year. And if you're 55 or older, you can make a $1,000 catch-up contribution. In order to make those contributions, you have to have a health plan with a deductible of at least $1,350 for employee-only coverage and at least $2,700 for family coverage. So this is not an account you could just open up and put money into to get this triple tax advantage. You must have a high deductible plan to put money in. So there's your connection between health insurance or health and building wealth. Today or last year, anywhere between 11% and 20% of the population in one of these plans. The numbers, they're still relatively low after 15 years, but they're increasing, though not at a very fast pace, but they are increasing. One of the advantages of an HSA is that you could use the money as a retirement savings vehicle. And we hear about that a lot. You could either pay for your expenses in retirement using this account, or you could even reimburse yourself for past healthcare expenses using this account. So you could put the money in, incur medical expenses, never touch the money 10, 15, 20 years later, save your receipts all those years, and take the money out on a tax-free basis. The money will be there for you. When it comes to how much money you could save over a number of years, if you save the maximum for 10 years for an individual, and you get a rate of return of, say, 7.5%, you'd have about $68,000 in your account. If you save the maximum for 40 years and got a 7.5% rate of return, you'd have over $1 million in your account. So there's a tremendous potential if you put the maximum in and you don't take any distributions. Clearly, how much you'll have depends upon how much you put in, how much you take out, whether you take anything out, and what your rate of return is. So there could be lots of variations. If you look at that 40-year number, instead of a 7.5 rate of return, if instead you had a 2.5% rate of return, you wouldn't have $1 million, you'd have $360. So that can make a huge difference in terms of the amount of money that's there for you after 40 years. Chris mentioned that the average couple could need more than $250,000 for healthcare expenses in retirement. It could be even more than that. If you're not average, if let's say you're above average and you live a long time, a couple could need as much as $370,000 for their health care costs in retirement. But please don't get the idea that, well, if I save for 40 years, I'm all set, right? I'm all set because I'll have $1 million. Think about the fact if you're 55 today and you have 10 years to save in your HSA, you'll have, let's say, $68,000 for a couple, almost $140,000. But 10 years from now, that $370,000 is going to be higher. Right? You're always going to be chasing that savings number, and you're never going to quite catch up to it. And who knows what it's going to be for someone who starts saving today, who's 25, saving for 40 years. They may need well more than $1 million. We haven't done those projections. So we've learned some lessons about the connection between health and wealth from our HSA database. We have, as of the end of 2016, 5.5 million accounts with over $11 billion in assets. In this data set, we get information on how much money people have at the beginning of the year, what their balance is. We know their end-of-year balance. We know how much money people are putting into the account. We know how much money their employer is putting into the account. We know what the annual distributions are. We know when the account was open, and we also know whether or not there were investments. This account, it's different. A lot of people are used to FSAs, where they have access to this money that comes out of their paycheck. But FSAs aren't necessarily invested. Right? They're not invested like a 401k is. An HSA can be invested like a 401k, and we get information on the presence of those types of investments and the balances in those types of investments in the HSA database. And there's, I guess I'd say good news, bad news in terms of what we find from the HSA database. Bad news being people don't take full advantage of the benefits. Among accounts opened in 2016, the average contribution, the average individual contribution was $1,300. And as I mentioned, the maximum for 2018 was $3,450. I think in 2016 was closer to $3,300, and even higher for if you have family coverage. So average contributions in an account a little less than $1,300 in 2016 among accounts open in 2016. But in 2016, those accounts that were older, let's say been around 10 years, they saw $3,300 going into the account. So clearly, the longer somebody's had an account, the more likely they are to put more money in. Over time, they see the value of putting in higher contributions. You see the same pattern when it comes to whether or not somebody invests in something other than cash. Among accounts opened in 2016, only 1% of those accounts were investing the money in something other than cash. However, if you go back 10 years to 2006, 10% of those accounts that were opened in 2006 were investing by 2016. One of the reasons why you may see lower investment amounts in 2016 is among newer accounts is because HSA providers typically have a minimum balance requirement in order to invest, and people might not have reached that minimum balance. Often it's $1,000, sometimes $2,000. But that minimum balance requirement is below the contribution maximum. So you could easily, well, I should say easily, but you have the ability to put the money in to meet that minimum balance requirement to invest even in the first year. But clearly over time, people understand the benefits of these accounts. They're more likely to tie up the money in investments. I think one of the reasons for that is because most of the population is healthy. Think about the 80-20 rule. The 80-20 rule is that 20% of the population uses 80% of the health care, which means 80% of the population uses very little health care. And over time, well, maybe in the first year, people are hesitant to put money into investments because they're afraid of that big expense. But then they realize, well, I didn't have any big expenses this year. I didn't have any big expenses the year before, and I probably won't have any big expenses this year, so why not start tying up the money in investments? But please don't get the wrong idea when it comes to investments that everybody who invests is saving the money for the long term. Okay, what we find is that people that invest are more likely to take a distribution than people that don't invest, and they take larger distributions when there's a distribution taken. That may be because they've built up an account balance. They feel, well, now's the right time to take a distribution, or maybe they're part of the 80% of the population that uses very little health care, but there was one year where they used a lot of health care because something came along and decided to take advantage of the distribution then. And investments aren't necessarily tied up. It may take a day or two to sell it and to get the distribution to cover the expense. But I think the fear is more along the lines of maybe this investment will be worth less than what I paid for it, and people are hesitant to sell at a loss. And finally, investments make a big difference when it comes to balances. Among accounts opened in 2016, those that didn't invest had an average balance at the end of the year of $970. However, among those that did invest, they had a balance of $5,200. Okay. That's not necessarily because they saw a tremendous rate of return on their investment in 2016. Chances are they didn't put the entire contribution in on January 1st. Maybe some did. Chances are they didn't. What's likely going on here is those that invest right away are putting in a lot more money to begin with, which is why they have higher account balances in that first year. But if you look over time, say go back another 10 years to those accounts opened in 2006, in 2016, those accounts with investments had over $27,000 in them, almost $28,000, whereas those that didn't invest only had $6,700. So investing obviously can make a huge impact on account balances. So conclusions: rising healthcare costs affect other finances. HSAs could be used as a retirement savings vehicle. You're never going to catch up to that dollar amount you need to save for your healthcare expenses in retirement, but that's mainly because of the caps on how much you can contribute to the HSA. You're limited statutorily, and that's just the way it is right now. And therefore, HSAs, they're not sufficient to save for healthcare in retirement. Something else, you have to find another savings vehicle if you want to cover those expenses by the time you're 65. Individuals do not take full advantage of HSA features, but over time they seem to be moving in the right direction. There's this question of, are they moving there fast enough or not? But there's certainly movement in that direction. So I'll end there and turn it over to Todd.
Thanks, Paul.